Good morning to everyone. Welcome to our second webinar titled You Are Not Alone, prepared by a group of third-year Bachelor of Pharmacy students from International Medical University, IMU, in collaboration with the Malaysian Parkinson's Disease Association, MPDA. I'm JK.
And I'm Rakshana.
And we'll be your MCs for today.
These are some of the ground rules of this webinar. Firstly, this webinar session will be recorded. Next, please ensure that your microphone and camera are switched off so that we can minimize the disturbances during this webinar session. Besides, please do type your questions and send it in the Q&A box anytime during the webinar session. We will address these questions during the Q&A session. Lastly, we will have a simple photo taking session at the end. Please switch on your camera at that time if you feel comfortable to do so. Thank you.
These are the organizing committee members, pharmacy students from IMU, with Rashana, Sauchin, Jenkai, myself, Jasing, Roshini, and Peizi. This webinar will be split into 3 sessions. Firstly, Ms. Puvessha will be giving a motivational and mental health talk for 30 minutes. Next, Ms. Shailaja will be sharing on some simple exercises that can be done at home and the importance of exercising in Parkinson's disease for half an hour. Lastly, we will conclude the session with a 15-minute Q&A and feedback session. During this session, we will be answering some of the questions raised by you in the Q&A box. Okay, so without further delay, let's begin our first session, a motivational and mental health sharing by Ms. Puvessha. She is currently a lecturer teaching at IMU. She is also a registered clinical psychologist with the Australian Health Practitioner Regulation Agency and the Malaysian Society of Clinical Psychology. She has a vast experience in both Malaysia and Australia in managing psychological conditions using evidence-based interventions within a clinical setting, correctional department, and community. She was also actively involved in improving the mental health of refugees and asylum seekers in Malaysia. She believes that mental health conditions can be managed and that people with mental illness have the right to live fulfilling lives. She is driven to bring societies and communities together in supporting the management of mental health conditions by removing the stigma surrounding mental health issues. So, I'm certain that she is the perfect person to share on this topic. A gentle reminder, please feel free to type your questions in the Q&A box and we'll raise them up during the Q&A session. Again, we would like to apologize for the disturbances earlier. So I would like to welcome Ms. Puvessha to share on her topic. Ms. Puvessha, the floor is yours.
Thank you so much. A very good morning to everybody. So let me try to get the slides up. So good morning, everybody. Today I'll be talking about Parkinson's and mental health. I'll be focusing a bit on the mental health impact of Parkinson's on both the patients and on caregivers, because I think it's equally important for us to care about the caregivers as well. I think they are usually forgotten, so I want to bring importance to both the patient and the caregiver. We'll then be looking at some signs and symptoms and what you can possibly do in that situation and where to go seek help, additional help. So first, let me start by giving you a brief description of what Parkinson's disease is. I'm sure most of you all here know. It's a brain disorder that leads to shaking, stiffness, and creates a lot of difficulty with walking, balance, and coordination. This usually happens in both men and women, but research has also identified that 50% more men are affected compared to women. Again, mostly happening at the age of 60. On very minor occasions that you would find individuals at about 50 years old having Parkinson's. You call it early onset. Yeah? Parkinson's disease usually occur when the neurons in the area of the brain that controls movement become impaired. So our brain has got different sections doing different things. Every component in our body is to help us function differently. So within our brain, there's an area that facilitates movement, helps us find balance. The neurons in that connection, the neural connectivity in that part of the brain becomes impaired. And that's how Parkinson's disease even begins. So there are several stages, and I think this stage is very important for us to know because the stages will also play an important role in triggering or exacerbating, making a mental health condition worse. So stage 1 is usually the beginning stage. You can only see mild tremor and usually just on one side of the body. That might be change in posture, walking, and facial expression. You're beginning to notice certain changes. Stage 2 is when tremor and rigidity begins to happen, and now it's happening on both sides of the body. So it's becoming a little bit more complex. Stage 3, a person is beginning to lose balance, and there's also slowness of movement. So at stage 3, you realize that the person who's suffering from Parkinson's disease is beginning to become more dependent on somebody else. Stage 4, they may stand without help, but movement requires a walker, that walking assistant. So when all the movements become more debilitating to them, more difficult for them, that's when you realize they're becoming more dependent. So again, we'll talk about the element of dependence in mental health a bit. Stage 5 is when there's stiffness in the leg, where it makes a person impossible to walk. This person may require a wheelchair or be completely bedridden. Now, when they're at that stage, they're almost completely dependent on somebody else or some form of assistance ability. Now, it's important for us to know this because it definitely affects a person's mental health. It's like a natural progression. Imagine us when we are up and running, we're able to do all our things, all our activities, no issues. We have a lot of confidence. But the moment we are unable to carry out our activity as we used to, it definitely causes some form of, a drop in self-esteem, a drop of self-efficacy, or we become more anxious, become more afraid of making the next step. Because what if you fall, or that whole thought of, I have to now depend on my daughter, I have to depend on my wife, or depend on my husband. The idea of depending on somebody else can also cause a lot of issues for a person, because you're so used to being independent. You can go wherever you want, do whatever you want, but suddenly now there's limitations to your actions. So that itself can be quite anxiety provoking or even depressive for some people. So let's look at what are these fancy terms that I'm using. So anxiety is basically an ongoing feeling of unease, worry, or fear. It means there's a underlying fear, like you're scared to do this, scared to do that. What if I fall? What if this happens? There's a lot of worrying, a lot of thinking. That's anxiety. And it's a natural reaction to situations you find threatening or difficult. So it becomes difficult to walk, difficult to go out, difficult to do certain things. You'll be worried. So the element of worry is what anxiety is. Depression is when you feel sad or a sense of emotional emptiness for a long time. So suddenly you feel so empty, you feel like your future, it looks very dark. You cannot see a very happy life or happy future ahead. So that is an important sign for us to note that maybe a person is beginning to feel depressed. Loneliness and isolation can also happen with someone with Parkinson's disease because they can no longer go out, meet people, meet friends. Again, the activity, that kind of independence and social skills that they had, they couldn't practice it. So they tend to be more isolated, staying in the house or lying down in the room. So this also can increase a person's likelihood of developing depression. Now, these two are very common among individuals who are dealing with Parkinson's disease. But what is it's not always seen, but it's an important element for us to focus, is psychosis. Psychosis, it sounds scary, but it actually means a person has either hallucinations or delusions. So hallucination is a fancy term for saying that you're beginning to see things that are not there or hear things that are not there. Your mind is playing tricks with you. And usually for individuals with Parkinson's disease, psychosis comes in a more, the hallucinations in a very mild version, in the sense that they usually can see maybe a dead friend, or maybe their own parent. They begin to hallucinate and see people that are no longer there in their lives anymore, but they're beginning to see them. Maybe they can sometimes hear them talk, hear these individuals talk to them. So there's visual and auditory hallucination, but it's usually not life-threatening or not harmful in any way. Not like individuals who have schizophrenia, not like that. And the thing with psychosis is that it's usually, delusion. Delusion is like your belief system. Suddenly you believe that, the whole world is not there to help you anymore. You're disappointed with the whole world. It's again, it's understandable for someone with Parkinson's, because again, you feel like your whole life has come to so much of limitations. So it can also be cost of that. Psychosis is very common common to have been triggered by the side effects of Parkinson medication. Because what happens is that when Parkinson medication, it all works under the dopamine level. So individuals with Parkinson's disease have abnormal levels of brain chemical called GABA and also dopamine. So what happens in individuals with who are undergoing treatment for Parkinson's, they're given a medication to increase the dopamine level. Dopamine is a chemical in the brain. So when you increase the dopamine level in your brain, automatically hallucination develops, because hallucination happens when there's high level of dopamine. So it's almost like a side effect of the Parkinson medication. But of course, if your doctor is prescribing you that kind of medication, they can also prescribe you a medication to make sure that it doesn't go too high to trigger a psychotic episode. So don't worry about it too much. What we're going to focus mostly is on anxiety and depression, because those two are things that we as an individual, we can also do something to help ourselves out of anxiety and depression. So that's what I'm going to focus on. Before that, let's take a moment and understand what happens for caregivers and their mental health. See, caregivers they're very important people in the treatment of Parkinson's disease. For an individual who's having Parkinson, when that idea of dependent steps in, you need this caregiver. This caregiver is a very important person. It can be someone within your family, it could be a nurse, it could be anything. If it's a nurse, it's a different thing. They're trained, they're ready to do this process. But if it's, let's say, someone within your family, your child or your sibling or your spouse, they very often have to give up their career at worst, or give up certain activities, their day-to-day routines. They have to sacrifice their routine to take care of this individual with Parkinson's disease. And definitely that's a decision they have made. They want to do it. They want to be there for this individual. They want to provide all kind of support. It's a decision made. But it often leads them to have poor quality of life, because they can't carry out their activities, their routine has changed. So sometimes they can disappear as an invisible patient. That means when someone with Parkinson's disease have got a lot of changes in their life and they're becoming anxious and depressed, the caregiver also has a lot of changes in their life, because they have to give up their day-to-day activity, the regular pattern of activities, to be able to become a caregiver. So they also go through a bit of depression, a bit of anxiety. And research have identified that 40 to 70% of caregivers are significantly stressed. They are stressed because sometimes they are not all of them are trained nurses, but when they have to take care of an individual with Parkinson's disease, they also have to figure it out. They also have to maybe talk to the doctor, talk to some nurses, figure out how to be of assistance to individuals with Parkinson's disease. So it can be quite challenging for them too. Hence, can trigger anxiety or depression. So you can very often observe that they might be quite tired, or sometimes they can be quite angry, and that's all signs that they may be overworked and burnout. All right, so these are some signs and symptoms of anxiety and depression that for you to look at and for you to reflect back. Do I have it? Do I have these symptoms? Now, a very, very important point to note here is we all go through some form of depression, some form of anxiety on a day-to-day basis. We all do. But when it becomes a mental health condition is when you're unable to carry out your day-to-day activity. That means your productivity or your activity is being affected. That is when you would say a person has probably the condition is serious enough to be diagnosed with a mental health condition. Right? So don't be afraid if you see some of these symptoms and you think, oh, I have all of this. I might be, don't jump to conclusion yet. Okay. So someone with depression is usually quite sad. They're always sad. They have no interest in doing things that they once liked. So maybe someone who used to like reading book, now they can no longer read book anymore. They don't find it interesting anymore. Well, there's a lot of feelings of guilt, self-criticism, worthlessness. They feel very tired, always very tired, no energy. Sometimes they eat a lot, sometimes they eat less, sometimes they sleep a lot, sometimes they sleep less. No motivation to carry on in life. Someone with Parkinson's will particularly feel like they are a burden to somebody, the caregiver, or they feel helpless or hopeless, cannot see a future. And occasionally some individuals also have thoughts of death or suicide. Yeah. So these are some signs and symptoms of depression. What else for anxiety? Anxiety, remember, it's mostly about worrying. So you have a person who's, excessive fear, worry. a lot of thoughts, a lot of unwanted thoughts, automatic thoughts. All thoughts are very negative in nature, very like troublesome. They're not happy thoughts. Then suddenly there's a wave of terror. Suddenly you feel so scared. You feel like your heart is beating so fast, and then you're sweating profusely. Some individuals have nightmares, sleeping problem, heart pounding, sweaty hands, dizziness, nausea. Anxiety has a lot more physical symptoms. So you can actually feel your heart pounding so fast, you have difficulty breathing, your hands are turning cold, you're shaking. Anxiety, again, more physical symptoms. Depression, you don't really see a lot of physical symptoms. So that's again another way of distinguishing whether you have anxiety or depression, depending on how much physical symptoms you may have. Yeah? Now that we have all the signs and symptoms, it's very, very important for us to note that the individuals with Parkinson's disease may not be able to identify. They might, sometimes if they have already gone to stage 4, stage 5, they may not be able to pick up their symptoms and say, I need to go see a psychologist or I need to go see a psychiatrist. They cannot do that. So the caregiver has to step in and see if there's a change in pattern. And if the change in pattern is purely due to Parkinson's disease or the effects of medication, or is there really a psychological condition that is going on? So that is something to identify. And in order to be able to identify that, you can take this, take the patient to see a psychologist or a clinical psychologist or a psychiatrist, depending on who's nearest to you. For caregiver, you have to also check on yourself. I know it gets really tiring. It gets into this whole routine. You may forget to check on yourself. So occasionally you check on yourself and ask yourself how you're doing. How are you emotionally coping? Do you need a break? Do you need to go out for a bit? Can somebody relieve you for a while? So these are things that you need to check on yourself. And if you notice that you're beginning to have all these symptoms that we have just looked at, the depression and anxiety symptoms, and again, it's a good indicator for you to also take yourself to see a psychologist or a psychiatrist. Okay, these are some things that you can do. Educate yourself about Parkinson's disease, its symptoms, including anxiety and depression. Say, one thing to note, one thing that I've learned about physical illness or mental health illness is that if two people can have depression but can project it very differently, so their symptoms, the way they look, the way they experience depression is going to be so different from one to another. And it's the same with Parkinson's disease too. How you and how maybe somebody you know has Parkinson, you're going to be so different from one another. So make sure you speak to your doctor, understand how Parkinson's disease is for you, what are your symptoms, what are your difficulties, so they become more confident, more prepared to go down this process of treatment for PD, Parkinson's disease. Keep a diary of your mood, your medication, your PD symptoms, so that you can keep track of what's changed. Or because sometimes we may not be able to remember. If I ask my clients, how did you feel last weekend? What did you do? How did you feel? Were you sad or were you happy? Can you tell me? Sometimes they cannot remember. There's so many things happen they cannot keep track. So I always tell them have a diary. Just a simple thing as today, what did you do? Were you happy? Were you not? Very simple sort of understanding what's going on in your life for you. And try to figure out what triggers your anxiety or depression. Or you can, of course, always go to a counselor or psychologist and we will work it out together. Talk to your doctor if you think you have anxiety or depression, your GP or your specialist who's treating you for your Parkinson's disease. Talk to them so that they can refer you to the right place. Tell your partner, family members, and how you're feeling so they can understand your emotions better. Don't try to keep it all within us. I know our Asian understanding is, we don't tell our problems to many people. We like to keep, these are very sensitive things, and we don't want to tell other people that other people judge us and all that. But I think it's very important that you have selected and trustworthy family members and friends whom you can have a heart-to-heart talk to. You can actually express yourself. How do you feel? How do you feel life as a patient with Parkinson's disease? How do you feel life as a caregiver to someone who has Parkinson's disease? What has it done to you? How has it changed you? Speak to your friend, speak to a family member. And so that, sometimes the person who's listening to you also be able to direct you in the right way. So if they can sense that you are having some signs of depression or anxiety, they can then refer you to a place where you can actually get help for that. understand the symptoms, because you know that how symptoms is different. So understand it, understand what is happening for you. And if you have a coping strategy that you're using to cope, let it be, maybe you cope by talking to your friend, cope by playing games or phone. If your coping strategy has stopped working, you can always try a new approach. And so remember that a coping strategy will not always work. Sometimes it will stop working. So that is a good sign for you to start trying a new coping strategy. Right? These are some treatment process. Medication is definitely one of it. So you've got to see a psychiatrist to get medication. Psychotherapy is something that a clinical psychologist would do. So something that I would do for individuals with Parkinson's disease or caregivers is to talk to them and see how we can adopt to the life that is happening now. What can we do to adapt to the changes that's happening to you? And how can we change the way we are processing it in our head? Are we looking at Parkinson's disease as something that no end of my life? Or are we looking at Parkinson's disease and thinking that what is the reason of this? What are you supposed to learn from this? Something more spiritual in that sense. Why do you have Parkinson's disease? What is it that you can learn from having this disease? What is meaning of life with Parkinson's disease? And also with the caregiver, how to cope with the stressors that you have to deal with, how to find a balance between you as an individual and you as a caregiver, so that you don't feel burnout. And also along that way, we'll also be doing relaxation techniques. So these are things that you can also please screen cap, take a photo of this, so that you can check on YouTube and follow some of these. So deep breathing exercise is actually a breathing method where you inhale your breath, hold, and exhale your breath. You have to do this for at least 5 minutes to see a difference. The idea is just to calm you down. So it regulates your blood flow and helps you have a more calm perspective. It comes with practice. It's not like 5 minutes you do, then suddenly you feel very relaxed. It doesn't work that way. It's just with practice, you will learn that when you become so anxious, to just calm you down for a moment so that you can think rationally. This deep breathing technique has been found to be helpful. Next is visual imagery. So you can imagine yourself to be on the beach or waterfall, forest, wherever you like, and how you can sort of ground your whole self in that scenario. So let's say I'm imagining that I'm at the beach. I can feel the sand on my feet. I can, feel the breeze in my face. I can smell the sea, things like that. Using all your senses and grounding you there in that scenario. So these are, again, very, very important tools to help us control our mind instead of letting our thoughts just fire everywhere and make us feel so overwhelmed with thoughts. These are very important strategies. Next, we have mindfulness-based exercises. Mindfulness is also something that, again, uses your senses to help you calm yourself down. Exercise is really important. Exercise releases happy hormones. So if you're feeling really down or feeling really anxious, exercise will just help you. It's the motivation to do exercise the problem, but once you've done exercise, you realize you always feel a lot calmer. Right? So that's what Shailaja will speak after this, the importance of exercise and what you can do. And very, very important is to connect with others. Don't feel like you need to fight the disease or fight the world all by yourself. Nobody can. We all need our friends and family and our fellow people around us. So please reach out to somebody, talk to somebody. Don't try to process this all on your own. It can be very, very tiring and very, very overwhelming. And also, whenever possible, schedule in some pleasant activities. Maybe both the patient and the caregiver can go out for a stroll, or you can sit down together and read a book together, or listen to some nice calming music together. Do pleasant activities, do things that are pleasant to you, like a little downtime, just to break free from your pattern of taking medication, eating, and that needs to happen. But also include some activities that have got more relaxing in nature. Right? I'm aware of time. I won't cross over. I have one last slide. These are some resources in which that you could go to, which is the Malaysian Parkinson's Disease Association, and they also have a Facebook. And I've come to learn that they organize and run certain support groups. So please try to attend some of the support groups. Support groups are very, very important. I'm in the process of developing a support group platform for Malaysians, but online, so where people meet together for various reasons. That's in the process. I'm trying to develop that, but at the moment, Malaysian Parkinson's Disease Association is there. It's already happening, so please join, both patient and caregiver, because again, this is a platform where you don't have to feel alone. There are so many people around you that you are not aware of, and you will become aware of during the support group that people are actually going through very similar situations as you are. So when you say something, the other people will be able to understand because you're all in the same boat, and you can learn from each other on different ways of coping as well. All right, so with that, thank you so much for your time and patience. I really hope that you've gained something out of this. We'll take your questions at the end after the next talk. Thank you so much.
Thank you, Ms. Puvessha, for the helpful session. As we all know, Parkinson's disease is challenging for both the patients and caretaker to cope up with. After this sharing, I hope everyone has a better idea on where to seek for help, and just know that all of you are not alone. We will raise your questions during the Q&A session, so I would kindly request Ms. Puvessha to stay in this webinar till then. Thank you.
So moving on to our second planned session, Ready, Set, Go! Exercise Therapy by Ms. Shailaja. Ms. Shailaja holds a degree in physiotherapy from Manipal University and a diploma in physiotherapy from Masa University. As a physiotherapist at IMU Healthcare Physiotherapy Center, she has also completed trainings and certifications in pain management therapy to further facilitate her passion in assisting patients achieve optimal recovery. A member of the Malaysian Physiotherapy Association, Ms. Shailaja's interest is in sports rehabilitation and musculoskeletal conditions, along with post-operative care such as anterior cruciate ligament, ACL reconstruction, and elderly care management such as Parkinson's disease. Ms. Shailaja firmly believes that basic awareness on the benefits of physiotherapy care could assist many in not relieving their pain, but also preventing onset of pain. This has motivated her to actively promote awareness to community via talks such as posture correction for elderly and exercise therapies for Parkinson's disease. She will be introducing on some exercises that can be done at home and the importance of exercising in Parkinson's disease in this session. A gentle reminder, please feel free to type your questions in the Q&A box and we'll raise them up at the end of the session. Let's welcome Ms. Shailaja.
Hi everyone, good morning. As everyone aware, Parkinson's need to do some exercises, yeah? I've been with this association for ever since I started to work in IMU. So we have a lot of talks, a lot of events, exercise and everything we have done. So today what we're going to emphasize is, we're going to emphasize on type of exercises which Parkinson patients can need to be done. It could be a very common one, but I just want to emphasize on why you need to do the exercises and how it's going to help you in Parkinson's disease. Okay, let's go for the facts and the solution. The facts is Parkinson's disease, it's a degenerative changes on your brain, which affects your movements. So just because it's going to affect your movement doesn't mean they need to be bedridden or static in one place. They need to be independent. So to do the independence, we need to teach them exercises. So what's the common questions Parkinson patients or the caregiver will have? First thing, can exercise prevent Parkinson? Second, does exercise slow decrease progression? Third, can exercise replace Parkinson medication? The last one is there any specific exercise for motor symptoms? Motor symptoms is basically their movements, such as their tremors, their posture, changes in the posture. So all this we call as motor symptoms. So the answers is, first, there's no therapy include exercise has yet been proven to prevent Parkinson, but it's proven people who regular with exercises are likely develop Parkinson patient. So when you start doing exercises, the circulation will be better. So when the circulation will be better, the degenerative changes on the brains will be a bit more slower. So there's no chances saying that when you do exercise, you don't get Parkinson. So when you do exercise, your circulation will be better. Second thing, Clinical studies have suggested that symptoms may progress slowly from doing exercises. Yes, the moment you get Parkinson ready, the degenerative changes in the brains will happen. But with exercise, it's reduced by improving the circulation on the brain, as it will activate your brain cells. Exercise is not a replacement of medication, but it's a combination method to control your symptoms. So some patients, when they do a good exercises, the medications for Parkinson, doctors will prescribe in a lower dosage. Some patients, they still have to maintain the dosage along with the exercises. Yes, each clinical symptom has an alternative way of managing, such as muscle cramp. Muscle cramps, tremors are very common for Parkinson patients. So by giving them a low impact exercises, it can help them to control their sinus symptoms. Are you ready? So let's go. What are the common issues Parkinson patients will face? First thing, their tremor. Second, their balance. Third, changes on the posture. So when they have changes on the posture, automatically they will develop joint and muscle stiffness. And the fourth one is poor facial expression. The facial expression, they lose the expression, they'll be very monotonous. So to improve your facial expression, there's a lot of exercises can be done to improve your circulation on your facial area. At the end of the session, I will show you a short video on how to do your facial exercises. Tremors. Tremors are very common for Parkinson patients. Tremors is because it's just a movements on their on-site movements on their wrists and joints. So to improve that, we ask the patients to go for fine motor skills therapy, such as writing, drawing, hand gripping exercises. This is more into fine motor skills. But besides that, we also encourage patients to do some stretches exercises and also weight training to improve their muscle strength. By improving their muscle strength, the tremor, sinus symptoms of tremor can be controlled. This is very important to improve the muscle tightness and balance issue. You see, Parkinson patients develop posture instability. They have joint stiffness. So by teaching them exercises, it will help them to maintain their posture in a better way, and also risk in fall will be lesser. So because of the balance are good, the risk in fall is getting more lesser. So next few slides, we're going to look into what exercise can you done to do the balance your to improve your balance. There is certain exercises which I've listed over here, like overhead press is one type of exercises. Close grip floor press is more into for your posture corrections. Superman exercises, bridging, and chair standings. The exercises might look like very simple, very basic, but I'm going to emphasize on why you have to do it. First, overhead press is basically to build your upper limb coordination, upper limb muscle strength. If you see this GIF, this man is holding a dumbbell, which doing the upper body exercises. Yeah, this GIF might show you in standing position, but a patient or Parkinson patient which has a balance issue, they always can sit and do their upper body exercises. Why this is important? You see, when the patient has the postural issue, they automatically slouch, right? So when they slouch, all their upper muscles over here will be very tight and stiff. So when they do the upper body exercise workout, it will help them to relax the muscles and also help them in postural corrections. You can always start with light exercises, light weights, such as maybe you just use your own body weight. And once you feel better, then you can go with a light medium. So this GIF has showed you with a dumbbell. For patients which don't have dumbbells at home, you can use a small water bottle at the both sides, and then you do your exercises. I will prescribe my patients for any kind of weight training exercises for beginners. We can start with 10 to 15 times, 3 repetitions. You need to understand this. Per day, once you do your exercises, you will never see the results, right? So every single exercises which we showed you or your physiotherapist is going to prescribe for you, You need to do it daily, regular basis. So per day, you have to do at least about 2 times. You can do morning one session, evening one session. This is one of the exercises for your upper limb strengthening exercises. Next, close grip floor exercises. This will help them to relax the chest muscles and also improve on the upper limb coordination. Why I'm trying to focus on pure upper limb coordination? Because when you have tremors, it's not only going to involve on your wrist joint, it's also going to involve on your shoulders and elbows. By doing your wrist stretching exercises and also upper limb muscles build, it will help you to control your tremor sign. So how are we gonna, so in conclusion, how are we gonna say to treatment for your tremor, you need to do strengthening exercises. Strengthening exercises for your wrist and also for your shoulder. Superman exercises. Superman exercises also will help you to improve your balance. Yeah. So a patients can do in prone lying position and then do their upper and lower limb exercises as the GIF shows. Okay. This is the muscles, your upper back and also your lower back muscles going to help you to correct your posture. So by doing these exercises, it will help you to strengthen your upper and also your lower body muscles. So eventually, it can help you in postural corrections. And again, what I said, you always start with a lighter amount. So you can start to 10 to 15 counts, 3 repetitions, and do it in a daily basis. Pelvic bridging exercises. Pelvic bridging exercises, it helps in strengthening your core muscles, your tummy muscles. Your tummy muscles and your lower back muscles need to work together so that your posture and your balance can be corrected. Chair to stand, or we call as another name we call as sit to stand exercises. Yeah. So sit to stand exercises is the best exercises for your lower limb. That means for your hip, for your knee, and also for your ankle. The more you can stand without any kind of issues and difficulties, that means you have a very good stamina, very good strength on your lower body. So per day, you can start like at least about 10 to 15 counts sit to stand, and then slowly increase the repetitions. Besides doing weight training exercises, you also need to do some aerobic exercises. What is this aerobic exercises? Aerobic exercises which improve your cardio function activities, like you're going for your cycling, you're going for your walking. So patients which have very good balance, they also can go for normal dynamic cycling. Patients which have poor balance, we prefer ask them to do a static cycling exercises. Or if you don't want to take any kind of risk, anything, the patients can be encouraged to go for a basic walking exercise. Even a basic walking exercise also will improve their cardio functions. So minimum, we ask the patients go for 15 minutes for a walk, maximum half an hour to see a better results. Okay, like what I told you initially, there is some facial exercises for Parkinson patients to improve their facial expression. Yeah, so I'm going to show you some videos. You can follow the exercises as along while watching the video.
Welcome to Parish Neuro channel. Today we will discuss about top facial exercise for Parkinson patient. Facial exercise helps to reduce the monotonous facial expression of Parkinson people. As we all know, due to the Parkinson disease, they lose facial expression and facial movement. Facial exercise helps to improve patient speed as well as improve eating style. So, today we will share a couple of top facial exercise for the Parkinson patient. I will demonstrate and show how to practice at home this exercise. Each exercise you have to repeat for 5 times, and each exercise you have to hold till 5 counts. Exercise number 1. Raise your eyebrows upward so your forehead is wrinkled like this. I have raised my eyebrows, you can see, and count 1, 2, 3, 4, 5. Relax. Again I'm repeating. I have raised my eyebrows. 1, 2, 3, 4, 5. Relax. Exercise number 2. You have to make an angry expression. So bring your eyebrows together. Hold this position for 5 counts. Okay? Like this. 1, 2, 3, 4, 5. Again I'm repeating. Bring your eyebrows together. You can see the angry expression and you can see the wrinkles between 2 eyebrows. And now count 1, 2, 3, 4, 5. Okay? Repeat this exercise also for 5 times. Exercise number 3. Close your eyes tightly like this. 1, 2, 3, 4, 5. Relax. Again repeat. 1, 2, 3, 4, 5. Repeat this exercise for 5 times. Another best exercise for Parkinson patient. Open your eyes big and wide. 1, 2, 3, 4, 5. Relax. Again repeat. Open your eyes big and wide. 1, 2, 3, 4, 5. Repeat this exercise for 5 times. Fill your cheeks with air. Open your mouth as wide as possible. You should be able to open your mouth. Okay? Ah. Again repeating. Okay. Exercise number 7. You have to give a wide smile. Okay. So could you please tell me that when do you smile last time? Now start practicing to smile. Okay. Smile wide and show your teeth. This is another best facial exercise. Okay. You just count in your mind 5 times and repeat this exercise for 5 times. Okay. Another best exercise for the face of Parkinson patient, that is, you have to bring out your tongue. Okay, like this. Repeat this exercise for 5 times and count 5. Exercise number 9. Take your tongue out and move it to the right corner of your mouth. Hold for 5 counts. Like this. Same exercise you have to repeat to the opposite direction. Like this. You have to rotate your tongue inside your mouth, clockwise and anti-clockwise, for 5 times, like this. Okay, now anti-clockwise. Hope you like this exercise. And trust me, if you practice this exercise, it will improve the flexibility and quality of your facial muscles. Believe me friends, exercise would not stop brain disease from progressing, but however, it will improve your balance. I believe this video will help you, but you have to promise that you will practice this exercise at home. And we would like to know the comment from you.
So I hope everybody enjoyed the video. The reason I'm emphasizing on facial exercises is because, like what we told you, we have seen a lot of Parkinson patients. They have come over here for their exercise and everything, but we haven't come across for facial expression exercises. So rather than showing us basic other exercises, I prefer to show these facial exercises more frequently, because other like upper limbs, lower limbs, spinal exercises, majority of Parkinson patients do aware and they know how to do it. But they don't aware about their facial exercises. So that's the reason in today's talk, I wish to emphasize on their facial expression exercises. So take home message, we have gone through what is the benefit of exercises. We have understand on type and purpose of exercises. In conclusion, we have come across of tremor, poor posture, poor balance, muscle tightness. And we also have taught you what kind of exercises to overcome your balance, your joint stiffness, and how do you improve your facial expressions. Thank you. So in case you have any questions, you can ask me, I'll answer you directly.
Thank you, Ms. Shailaja, for the interesting session. I hope everyone can understand better on why exercising is important in Parkinson's disease, and I certainly hope that everyone will do the simple exercise routines shared by Ms. Shailaja at home. If you cannot remember the steps, don't worry. We'll be sharing the recording after the webinar.
After listening to both these sessions, I'm sure some of you have questions to ask. Grab this opportunity to ask your questions during the Q&A session. There can be two methods in asking your questions. If you're using your phone, please click on the Q&A icon at the bottom, then click on an Ask a Question button, and you can type your questions in the box. Alternatively, if you're using a computer, just click on the Q&A icon at the bottom of the window, and you can type your questions in. For your information, due to time constraints, we will try our best to address as many questions as possible. The remaining questions that are not answered, do not worry, we will compile them and send the answers to every participant via email by Ms. Sarah. Let's begin the session. So the first question is to Ms. Puvessha. The question is, why is a Parkinson's patient prescribed with Remeron? And what are the side effects of Remeron? Ms. Puvessha?
Yeah. I'm not a psychiatrist to begin with, so I cannot give you too much information on what Remeron is or the side effects and how it benefits you as an individual. But I can say, based on my knowledge, what I understand about Remeron, why it's prescribed for Parkinson's disease, is because it helps to also improve movement. So it reduces movement deficit and also reduces depression, because Remeron affects a particular chemical in the brain which improves both depression and Parkinson's disease. That is to my knowledge. Thank you so much.
All right, thank you, Ms. Puvessha. So in summary, Remeron helps to improve both the movement and reduce depression. Okay, then we'll move on to the next question.
All right, so the next question, I think this question is for Ms. Shailaja. So it's asked by Mr. Lim Buseng, and the question is, why does a patient get tired easily even by doing simple exercises such as walking in the park? Ms. Shailaja?
You need to understand, first thing, walking in the park, how long does the patient walk? And if the patient has a very good stamina or not. If the patient has a poor stamina and you're going for a longer distance walk, for sure they'll feel pain and tired. That's the reason I'm emphasizing on for them to do their functional training exercises like weight training to improve their muscles. Then they can go for the walking exercises. So they need to focus on how good is their stamina and is how strong enough their muscles is.
All right, thank you, Ms. Shailaja. So to summarize, it actually depends on your stamina, you see. So if you have poor stamina and you walk long, you definitely feel tired. So Ms. Shailaja has suggested you to do some like functional exercises first to improve your muscle strength, and then you can, after doing that, then you can start walking depending on your, as much as you can lah. Thank you. Let's move on to the next question.
Okay, so the next question is directed to Ms. Puvessha. Ms. Puvessha, generally, is there an effective way to overcome severe hallucination which occurs concurrently with dreams?
Okay, I've actually typed a message back to the person who has asked this question. I'm curious to know what their experience was with hallucination and dreams, because they're two different components. So if it's happening together, I would like to know the experiences before I can explain. So it'd be good if the participant can explain. their situation or their question further. But if not, I will still explain to my best ability. So hallucination is something that you see and hear that are not really there. If it happens in a dream, then that would be considered as a dream, and that happens when you are asleep. So that would fall, and it won't fall under hallucination. But if you are awake, wide awake, and you are hallucinating, then that's not a dream. There are two different components to it. So that means it's pure. If you're awake and you're seeing things that are not really there, that's already hallucination, not a dream. But if you've fallen asleep, then that's a dream. Okay, so that's the two, the way you distinguish them. Hallucination is best dealt with with medications first and foremost, because we already discussed earlier that the medication for Parkinson's will tend to trigger hallucination, so that medication needs to be revisited so that the side effects can be dealt with. But if someone is having dreams and the dreams it's scary or it's frightening in nature, then that would be more psychological. So what's bothering them in their day-to-day lives that they have not dealt with, that is occurring in the dreams and beginning to make them anxious. So then that is something that can be dealt in therapy.
Okay, thank you, Ms. Puvessha. I think we can move on to the next question.
Okay, sure. All right, so the next question is for Miss Shailaja again. So it's by SH, and the question is, what kind of exercise is recommended to prevent falls? To prevent falls.
Okay.
Yes.
Falls, we need to understand why the falls happens. As I told you earlier, when they have a poor balance, the falls happens. So how do we improve the balance? By giving them strengthening exercises, mainly for them balance and a core, and also their lower limb exercises. So the previous slides, as I showed you, there's few certain exercises like Superman can help them to prevent their upper and lower back strengthening exercises. Sit to stand also can help them to strengthen their lower limb exercise, lower limbs. So when they're doing these two exercises, it can help them to prevent fall. So improve your balance, that will lead to prevention of fall.
Right. Okay, so to summarize what Ms. Shailaja said, first of all, if we talk about falls, we need to understand what kind of fall it is. Like if it's due to like poor balance, then we'll probably need to do strengthening exercises, which will improve our core and our lower limb strength. So based on the slides before, Ms. Shailaja has shared some exercises that could improve the core and lower limbs, such as the Superman exercise. And we'll be sharing the recording later, so all of you can refer to the slides earlier and do the exercise accordingly. Yeah, let's move on.
All right, so the next question is to Ms. Shailaja as well. Miss, is running recommended for Parkinson's patient?
That is based on, I need to assess the patient first. Based on the assessment only, we can tell whether the patient has a good balance or not. And then from there only, we can see whether the patient is recommended to go for running or not. Basically, we don't encourage much on Parkinson patient because we scared their balance is quite not so good. They tend to have the high risk and fall.
Okay, thank you, Ms. Puvessha. So basically, you need to assess the patient's balance first before recommending any running exercises. And for Parkinson's patient, running is not much recommended because it might lead to fall. So assessment is required first, in summary. So we move on to the next question.
Okay, so this question is for Ms. Puvessha. What will help to relieve my sleeping problems? What can I do to relieve my sleeping problems, basically?
So definitely would be, so what keeps you awake? What keeps all of us awake is usually our thoughts. So when you're anxious, you're constantly worrying, these thoughts usually tend to keep us awake. So engaging in deep breathing technique, engaging in some visual imagery just to help calm your system down without the interruption of the thoughts would actually be able to trigger sleep. So sleep and thoughts all happen in one same place. So when there's a lot of thoughts, a lot of worry, sleep can't be generated. So when we can reduce the effects of the thoughts or reduce how nagging the thoughts can be, if you can reduce that, automatically sleep will not be an issue. So with that, relaxation mechanisms and methods to manage our thoughts will be very effective for sleep production. So I'd say try this first before taking medications, because we don't want to depend on medication for sleep.
Okay, so to summarize again, it depends. Usually the thing that keeps us awake is actually thoughts, especially like anxious thoughts or worrying thoughts. So Ms. Puvessha has actually recommended like some relaxing techniques such as deep breathing or visual techniques so that we can relieve and soothe the anxious or like worrying feeling, and it could perhaps help with relieving your thoughts and perhaps could help with your sleep.
Yes.
Yeah, that's about it. Thank you.
Okay, for the next question is directed to Miss Shailaja. So, Miss, is it common that Parkinson's patients' eyes tend to close most of the time? If so, what are the exercises to improve it?
As I explained earlier, Parkinson patient has a monotonous facial expression, right? So the muscles are become very stiff and tight. So eventually they have lost their coordination. So by doing some facial expression exercises, as I shared the video before, it will help them to improve their muscle strength on their facial. So do some lot of facial expression exercises like eyes opening, eyes closing. All this will help them to improve their muscular structure on the eyes area.
All right, thank you. So to summarize, yes, it is common for Parkinson's patient to have this eyes closing because due to the symptoms of muscle stiffness, and that can lead to loss of coordination. So as Ms. Shailaja just now shared a facial exercise video, so participants can do that exercises to improve more on your eyes movement. Thank you. Next question.
Okay, so this question is for Ms. Shailaja again. What can patients do when they suffer sprains from exercise? This question is by Gan Chong Moy. So what can they do if they have sprains after the exercise?
What can be done after if they have sprain or injury after the exercises?
Yeah, precisely.
Okay. The first thing is we need to understand the mechanism of injury. Okay, if the injury is kind of very vast and it's very deep, they need to see a medical attention. Otherwise, they need to go for they need to rest. They need to apply ice. And then if they have like ankle injury or something, then they need to wear a support to prevent it to become worse.
Okay. So basically, it depends on what type of injury you have. It's best to get medical attention for an injury, but generally we would recommend rest and to ice the injured portion. Like for example, if it's your ankle, then we need to ice your ankle. And perhaps if you have like an ankle guard or a knee guard or something to something to compress it, then you could wear at the injured portion as well. Is that right, Ms. Shailaja?
Yes.
Yeah. Okay. Thank you.
Okay, the next question is to Ms. Puvessha. There's a question that the patient say, I was diagnosed with Parkinson's recently and have been feeling very down ever since. Is there anything I could try to help me get better?
Okay. Feeling down sounds like, it's got a lot to do with probably receiving the diagnosis and also trying to cope with the progression of Parkinson's disease. So feeling down is also a sign that you got to work on managing it as soon as you can. I would start by trying to pepp yourself up. So a lot of self-talk, a lot of motivating self-talk, a lot of looking into the future and hoping that something good will happen. Like, don't be so heartbroken, but look at what you can do with whatever means that you have. Engage in pleasant activities, things that you like to do. Find new hobbies if your old hobbies no longer work for you. Reach out to others, talk to them, feel connected with people again. Don't feel so left out. These are important things for you to do on your own. But despite all this, if you still feel quite down and quite low, I would highly suggest for you to speak to someone professional about it.
All right, thank you. So in summary, if the patient is feeling down, then they should try to manage it as soon as possible and trying on motivating self-talk and hoping in future that something good will happen, engaging things in they like and feel connected with people. And if it's getting worse or if it's not resolved, then please do seek professionals' help.
Yes, because that only shows that the coping mechanism is not working and we need to figure something out together. So what I'm telling you are just basic things, but if I met you in sessions, for example, if you went to a clinical psychologist, when you talk to your clinical psychologist or your counselor in person, so we could discover coping mechanisms that work specifically for you, because we'll understand how you function, how your mind functions. So it will be more tailor-made. So what I'm telling you is very general. It might or might not work. So it's best to meet a psychologist in person. Thank you.
Okay, thank you. Next question, please.
Okay, the next question is for Ms. Shailaja. It's by Mr. Shaikh Mohammed. The question is muscle contractures reversible in Parkinson's patient, and can massage help in improving the symptoms?
Muscles contraction is basically of the muscle tightness though. So we need to understand how bad is the muscles contraction. If the patient has going through a severe muscle contraction, the medical doctor itself will really prescribe prescribe medications. Along with that, we also can do some passive stretching, and also massage can help them. But you need to understand how bad is the contracture is. So if it's very bad, if you're not sure how to do the stretches and everything, please come down to personal sessions, then we can go through one-to-one session that will teach you what kind of things you can be done in do's and don'ts.
Okay, so basically, the muscle contractures is actually muscle tightness, and there's a different degree of muscle tightness. So if it's very severe, you might need to see a doctor, and perhaps the doctor will prescribe a medication. But if it's more minor case, then perhaps some stretching or massage can help the symptoms. And if you're unsure with what kind of massage or stretching exercises to be done, perhaps you could visit a physiotherapist to get some help, right?
Yep.
Yeah. All right.
All right. The next question is to Ms. Shailaja as well. There's a question stating that I don't have hand tremors, but I am experiencing mouth tremors. What exercise is best for me?
You can try with facial expression exercises, which I shared in the link. At the same time, you also can practice reading louder. So when you read louder, you're actually activating your mouth muscles. So by reading louder or singing, it will help you to control your tremors.
Okay, thank you, Miss. So basically, facial expression exercises can still work on these mouth tremors, and also patients can read louder or sing louder to improve their symptoms. And for the facial expression exercises, we would send the link at chat box. Thank you.
Okay, so the next question is also Miss Shailaja again. So this question is, what can I do to improve the Parkinson's patient standing posture? So I think the person asking currently can't stand straight. So perhaps you could recommend some exercises or routines to improve the posture.
Okay, like what Ms. Puvessha has said, there are stages of Parkinson, right? We need to understand this current patient in which stage they are in. Okay, they might be beginner, but then they don't know how to, because of the habitual, they tend to slouch everything. So we need to assess part by part, and then we can train them to do what they're supposed to do.
All right, so
Assessment is needed.
All right, okay. So based on a vague question, you cannot determine, but because there are many different stages of Parkinson, so it will depend on what kind of stage you're in, and based on that, then only we can give more detailed answers. Is that right?
Yep.
So perhaps maybe you could go to your the nearest physiotherapist to seek some help lah.
Yep.
Right. Okay.
Okay. The next question is to Ms. Puvessha. Is melatonin recommended for Parkinson's patients?
Melatonin is to help with sleep. So if the patient is particularly having sleep difficulties and unable to sleep despite all the other relaxation methods, then melatonin can be prescribed for sleep.
Okay, so if methods such as relaxing methods cannot help the patient, then melatonin do help for sleeping patterns. Yeah. Next question.
Okay, hi. This question is for Ms. Puvessha again. Is meditation effective for Parkinson's patient, perhaps to improve the mood, I think? This question is by Ella.
So if I heard you correctly, the question is about meditation, right?
Yes, meditation, not medication, meditation.
Okay. Meditation would work to help calm you down. So when you look at anxiety or depression, it has got a lot to do with our mind, right? A lot of thoughts, a lot of confusing thoughts, a lot of bombarding thoughts. Meditation would help to free your mind for a while, for a brief moment, just so that you don't feel so trapped with all those thoughts. So meditation will work for anybody who is having a lot of thoughts to deal with. But I also know that meditation doesn't sit with everybody. Not everybody can do meditation. It's very complex. It takes a lot of practice. So I would suggest starting with mindfulness. So you can YouTube some mindfulness-based relaxation exercises that would include mindfulness-based breathing exercises, mindfulness-based walking exercises. The concept of mindfulness will help you to begin the whole meditation process. It works the same way, but meditation can be a little bit more complex for beginners. So you can start mindfulness first because it's more, it's easier to follow, but definitely effective.
Okay, so meditation can definitely calm a patient down because it can free your mind for a while from the anxious and negative thoughts. However, not everyone can do meditation immediately because it actually takes a lot of practice. So perhaps if you're a beginner in meditating, perhaps you can start looking up for some mindfulness exercises on YouTube first, which is kind of similar with meditation, and you can go up step by step before going to the full meditation. Is that right? Yeah. Okay.
Absolutely
Thank you.
correct. Yeah.
Yeah. Okay. Thank you.
Okay, so the next question is to Miss Shailaja. Miss, how to deal with cramps of legs and face?
How to deal with cramps of face and legs.
Yes.
Basically, what I will encourage my patient is first thing, if they feel cramps on the calf muscles or legs, is by soaking their leg in warm water, and also doing some calf stretching exercises can help. For facial, they also can do some facial massage, which increase the blood circulation and reduce the cramps.
Okay, so in summary, if it's leg cramps, then soak in warm water, and you can also do calf stretching exercises. And if for facial, you can do facial massage. Yes. Okay. Next question.
Okay. So the next question is for Ms. Puvessha, and I think this question is like referring to the melatonin question earlier. Can melatonin be taken for long term?
Melatonin depends, because it depends on how your body functions. So I would suggest best speak to your doctor about it. For some people can't, because they get used to it, so they can't produce that amount of sleep. Quality of sleep will get affected because they get used to the dosage, so you have to constantly up your dosage. For some people, they don't really need melatonin on a day-to-day basis, only take as per needed, then that is fine. But again, it is very, very individual sort of process to it. So speak to your treating physician on whether you should be taking it long term, or what are the alternative things that you could be doing. So like all the relaxation techniques, the psychotherapeutic techniques, these are things that you can do without the interference of any chemicals into your system. So maybe you want to alternate with some of these techniques so that you don't have to create dependency on melatonin. So it's something to discuss with the physician for sure.
Yeah, all right. Okay, so to summarize what she said again, so it depends if you on this question, it actually depends on how your body responds to the melatonin tablets, because like different people will like respond differently to the medication. So some people can't take melatonin long term because their body will get used to it. So in other words, the melatonin tablets will not work as effective as before. So perhaps like you will need to discuss with your doctor if you feel like the melatonin is not working that well. But in other cases, some people do not need to take melatonin every day to get like an effective response. So it really depends on you, and perhaps you can try to look for other alternatives that can help with your sleep quality, like some of the exercises Ms. Puvessha has said earlier, like the deep breathing exercises, so on and so forth. So at the end of the day, you will need to like discuss with your physician about the melatonin issue. Yeah. Okay, so this will be the last question due to the time constraint, but don't worry, we'll send out a written response to all of your questions to Miss Sarah, and she'll distribute it later. So sorry about that. But so we'll move on to the last question. This question is for Miss Shailaja. Are there any devices for micro blood circulation that helps in balance?
The question is not so clear, but then based on my understanding, they want to improve their blood circulation. Is that so?
Yeah.
Okay, to improve your blood circulation, you need to do your exercises. That's why going to help you into your balance. But if you ask me, is there any device to improve your micro blood circulation? I'm really not sure.
Yeah, I think this. Okay, thank you, Miss Shailaja and Miss Puvessha. I think this is all the questions that we will answer due to time constraints. But we sincerely apologize for that. But don't worry, we'll answer these questions, the remaining questions that are unanswered, and we'll send to Miss Sarah, who will distribute to everyone. Okay. So please kindly take 2 to 3 minutes to fill up this feedback form to share with us your thoughts on today's webinar. We will collect your contact number or email address so that we can get back to you with all the unanswered questions. Additionally, the recording of this session will be sent to Miss Sarah to be distributed to everyone. Please scan the QR code displayed or click the Google link form in the chat box so that to give your feedback. Do not go away as well. Please stay back for a few minutes for a simple photography session before we conclude. Thank you.
Hello everyone. Now before we end our webinar, we would like to take a group photo with everyone. Please give us a moment and we will now promote every participant as panelists. Please feel free to switch on your camera if you are comfortable to do so. To switch on your camera, kindly click the start video button at your bottom left corner. Is everyone ready? Okay, now I will be taking the first photo. So in 3, 2, 1, smile. Okay, let's have a second one. 3, 2, 1, cheese. Okay, thank you everyone.
So we have finally come to an end of the session. Thank you, speakers, for spending your time for sharing on both topics of mental health and exercise for all of us. Thank you all the participants for participating in this webinar session. We genuinely hope that this session has helped you in some way. A gentle reminder, please do kindly provide your feedback by either scanning the QR code or through the link that has been posted in the chat box. Stay safe, everyone. Take care. Bye-bye.
Bye.
Bye-bye.
Thank you. Bye. Love you.